What is up, my spooky dudes, and welcome to Spooky RX. This is RX Study with Ari. Come study for Netflix with me. Alright, so as promised, this is a video regarding a topic discussion today about hypoglycemia. So, hypoglycemia, signs and symptoms. So, for our patients, we definitely want to counsel them on these signs and symptoms: sweating, pallor or whiteness of the skin, irritability, hunger, lack of coordination or like dizziness, also sleepiness. So these are signs that patient may be experiencing hypoglycemia. Now, do remember, our patients who are taking beta blockers, these signs may be blocked. So we do want to keep that in mind for those patients, just kind of reminding them of that and to regularly check their blood sugars. There's different levels of hypoglycemia, level 1, 2, and 3, depending on the severity. So level 1, usually sugar levels are typically between 54 to less than 70. And then level 2 is less than 54 milligrams per deciliter. And then level 3, typically patients have some sort of serious event, including unconsciousness, cognitive impairment, and these patients usually will require some sort of assistance. So treatment, there's a 15-15 rule that we can counsel our patients on. The 15-15 rule means 15 grams of carbohydrates. If they check their blood sugar and they're somewhere in that level, we're going to do 15 grams of carbs. That could be 4 ounces of juice or soda, jelly beans or hard candies, a tablespoon of sugar or honey. Typically, I want to advise my patients to do like the liquid, the juice, the soda. The soda is really good. It gets, the sugar in there quickly into the body. And then we wait about 15 minutes and we check our blood sugar again. If it's still low and if they're still experiencing symptoms, we want them to repeat the steps until they have at least 70 milligram per deciliter readings. Once they have that reading, they're welcome to eat a small snack or a meal. We also want to make sure that we're letting any of our providers or diabetes care managers know that they had any sort of episode like this. I did also list glucagon here, so when blood sugar is too low, to use the 15-15 rule. In the event that patient goes unconscious, they need to be taken to the hospital, and you're the pharmacist in the emergency room or in the hospital, you may need to know this. So this is glucagon administration. So usually it's a IM, IV, sub-Q. These things can be given to patient in serious situations. 1 milligram repeat every 15 minutes as needed until our sugar levels are above 70. And then intranasally, they do have a glucagon spray. That's a 3 milligram dosage, and that's into one single nostril. We can repeat that in 15 minutes as needed. Okay. These are things that can be prescribed to patients. Specifically subcutaneously and intranasally. Obviously, the IM and IV are things that are going to be administered at the hospital, but those that I just mentioned, the sub-Q and the intranasal administration, are things that can be prescribed to patients, especially patients who are prone to hypoglycemic episodes. So these are things that they can have on hand and that they can train somebody on how to use. Again, though, if someone is unconscious, we definitely want to make sure we're calling 911. All right, that's all I had for today's topic discussion. Hope you guys enjoyed that. Again, please feel free to email me if you have any questions or comment down below. Like and subscribe, of course, if you want to see more content like this, if you're looking to study, or if you're just interested in pharmacology. But thanks for watching.